morning. My name is Dr. Rois at Rois Medical Group. Today we're going to talk about hypertension. So hypertension is defined as your blood pressure elevated. So any blood pressure readings above 140 over 90, we'll call it hypertension. There's some isolated hypertension, such as, your first number, which is the systolic blood pressure, okay, might be normal, but the second number is elevated. We call those diastolic hypertension. There is as well a elevated blood pressure that is not related to just the hardening of your vessels, and instead is something called secondary hypertension, which for that, obviously the workup is much more extensive. There's a battery of lab work that needs to be addressed, as well as imaging. Every single patient that has elevated blood pressure, like I just said, over 140 over 90, should have at least once a year an echocardiogram, which is an ultrasound of the heart, and then obviously an electrocardiogram, which is the electrical part of your heart. It's important for us to understand where you at and if this hypertension is already creating some damage in your heart. Most of the patients, probably they don't know that the blood pressure is elevated, but there's some symptoms that might tell you, okay, something is wrong with my blood pressure. One is headaches, which is always intense, it's global headaches. It's always associated with blurred vision, tinnitus, which are those ringings in your ear. Sometimes you can have some chest discomfort, but just be careful. Chest pain could be something much more concerning. Some difficulty breathing. Some people might have some lightheadedness. Some people might feel fatigue. So a lot of these is what we put it all together in a cluster symptoms we call vasospastic symptoms. Every single patient say, well, my blood pressure is elevated, and so, well, be careful. Blood pressure, actually, your body will try to control it, in such a way to keep you from the danger. But if you don't have medical assistance immediately, one of the major concerns with high blood pressure is, one, a stroke, that it could be very devastating and debilitating. And then the other one, it could be a heart attack, okay, a myocardial infarction. Some people might have hypertension for many years and not knowing that they have it. And then suddenly, sometimes, you can start developing on these big vessels something that is kind of a ballooning shape. It's called aneurysms. Those actually can develop in big vessels like an aorta, and those actually can rupture. So very, very concerning. Sometimes, you won't have time to get medical attention. I have tons of patients that come over and ask me, hey doctor, how you pick up the medicines for my high blood pressure? And there's a lot of factors that come in play to decide which is the best medicine for you. First of all, I guide myself through the Joint National Committee and then compare with the American College of Cardiology, American Heart Association. So I follow these guidelines. Not only that, I obviously checked all the past medical history, and finally, what race you are. And the reason for that is because not everybody will do well on every single antihypertensive medicine that we have available. Most of the patients will do just fine with one medicine, but I would say that the majority of the patient will probably require two medicines to control the blood pressure. Usually before starting the medicines, it's important to understand what medical problems, chronic medical problems do you have, what is your kidney function, and obviously what is your liver function too. I do as well check proteins in your urine. There is a ratio that we call the microalbumin and creatinine ratio. We look at that in order to pick up the right regimen for yourself. Besides the medicines that we prescribe, there's many other things that we can do to help your blood pressure. For example, there's latest studies on roots such as beets. That's something that you can consume. It will help reducing your blood pressure. This is actually something that you can read from New England Journal of Medicine, the benefits of this root. But yes, beets will help. Obviously, a low salt diet, exercise, for example, 30 minutes of a brisk walk every other day. That's actually what the American College of Cardiology recommend. Obviously, if you're overweight, losing weight will make a big impact. And perhaps, down the road, not needing the medicines to control your blood pressure. Here at Rois Medical Group, we try to see our patients not only from just one angle, we try to see the patients as a whole. We always check the psychosocial aspect of your life as well as your biological standards. So come over, visit us if you feel your blood pressure is now well controlled, or you feel that you might have or suffer from hypertension, and you notice that the medicines that you're taking are not making a difference in you. By all means, we'll be happy to review it and hopefully get the best treatment or regimen for you. Please follow up Rois Medical Group. We have the link in the website. We'll be happy to help you.